As we get into October, we're going to talk about cough, cold, and flu season today. Cough and cold is probably in the top 5 reasons for visits to primary care doctors in the country. And more often than not, they're caused by viruses, and there is no other treatment other than just over-the-counter supportive care, hydration, rest. A lot of times we get people coming in for antibiotics. What we try to explain to them is that we need to be very judicious about antibiotic use given the rate of resistance to bacteria that we're seeing in our clinical practice. People often comment on the color of their snot, either green or yellow, which in their mind indicates that they have a bacterial infection and need antibiotics versus a viral infection. What we try to educate patients on is that the color of their snot or mucus has no bearing on whether something is bacterial or viral. And the only time that it matters is if the mucus that you're draining is white, thick, pussy looking in nature. The indications to treat an upper respiratory infection with antibiotics are really twofold. Number one, the symptoms are lasting more than 7 to 10 days and not improving or getting worse. Number two is what we call secondary worsening. So you have typical head cold, cough symptoms for about 5 to 7 days. You feel better for a day or two and then feel like you get hit by a truck. If those things are happening, then a trial of antibiotics to cover for bacterial sinusitis and bacterial causes of infection is indicated. Obviously, if people have one-sided sinus pain and pressure at day 2 with a high fever and they're draining pussy-looking sputum from the nostril or from their nose, then yes, that would be an indication to come in and get seen or contact us. But what we're trying to do is use everybody's time judiciously, use everybody's money judiciously, and make people aware that a majority of these upper respiratory infections, cough, cold, flu, are all viral in nature, and there's very little to do except supportive care, rest, hydration, over-the-counter, Theraflu, Tylenol, cold and sinus, Dayquil, NyQuil, whichever medication works for you. Typically with the flu, you have the high fever, sore throat, cough, body aches, fatigue, all that type of stuff. Usually it peaks around day 3 to 4 where you feel miserable, and then everybody usually starts getting better. Obviously, we're happy to have you call us or email us to get advice, good hand washing, not sharing toothbrushes, utensils, glasses. For people with kids in school, these infections are spread through respiratory droplets, so it's very common that if you have children in school, you'll be seeing a lot of these. We're happy to guide you through them. We know they feel miserable. No one enjoys being sick, but a lot of times the tincture of time is the best cure, and sometimes doing nothing is doing more. Another way you can prevent this stuff is come in, get a flu shot. No, they're not perfect, but it is a good way to reduce your risk of getting the flu. And also, what I think a lot of people don't understand about vaccines in general is, yes, they're to protect you, but more importantly to protect the community for people who don't have the immune systems, whether they're on chemotherapy for cancer, immunosuppressive drugs, infants who don't have a built-up immune system yet, and the elderly who can get severely ill from the flu. Most of us that are young and healthy will feel sick for 7 to 10 days and deal with it, and then we get better. But for infants and elderly, the flu can lead to hospitalization and even death. So we encourage people to get the flu vaccine. If you have any questions about that, feel free to email us or call us. We're happy to guide you through it. Again, we're just trying to review what things require you to contact your doctor and which things don't. But again, we're happy to help in any way we can.